going to go ahead and introduce our presenter today. Such a wonderful person. We communicated by email, and then when she called, I knew it was instantaneously going to be a great connection for the Paula J. Carter Center on Minority Health and Aging. Tara McKinney is the Viral Hepatitis Prevention Coordinator at the Missouri Department of Health and Senior Services. In her role as coordinator, her objectives are to provide viral hepatitis education and develop partnerships for linkage to testing and care. Throughout her 19-year career working for the state of Missouri, she has worked in various capacities within the department and has an extensive background in program management, health education, communication, and policy development. She received her community healthcare worker certificate from the State Fair Community College. Tara is a self-proclaimed humanitarian with a passion for public health and health equality for all people. Without further ado, please welcome Ms. Tara McKinney.
Well, I can't top that good morning that you all had this morning. That was amazing. I love it, and I want to thank you guys so much for having me here today. And while hepatitis isn't that exciting of a topic, I'm going to try to make it as fun as we possibly can. So, again, thank you for having me. And as she said, my name is Tara McKinney, and I'm with the Missouri Department of Health and Senior Services. And my main objective, like she said, is teaching people about hepatitis and how to protect yourself against it, how you get it, when to get tested, and all of that good stuff. I'm going to start off this morning with a video that we created within my bureau, and it's starring me, so it's really cool. I'm not trying to claim to be an actress, and you'll obviously see that on this video. But it's just a short 3-minute video to kind of get us kicked off to this topic, and then we're going to go a little bit more in detail about what we hear on this video.
Give me just a minute. I'm sorry, I had to reboot the computer.
Sure. So I'll just, while he's doing that, I'll go over what's in your packet. And there's some handouts, and these are from the Centers for Disease Control. And they are the ABCs of hepatitis. And we're going to talk about each one of these because it's important that you know not only about hepatitis C, but the difference between what A, B, and C are. Because they are completely different, you get them different ways, and they have different, while they have the same signs and symptoms, they're all a little bit different. And then the other one is about hepatitis C and being born between 1945 and 65, and why this population is specifically at risk. And then finally, the hepatitis C, what to expect when getting tested. And this is just about the testing for hepatitis C and what it entails. So, again, we're going to go through all of this, but these are just handouts that you can take home with you. Okay.
Now we're going to talk about viral hepatitis, which is a liver disease caused by a certain type of hepatitis. The most common types of hepatitis reported in the United States are hepatitis A, B, and C. So let's start out talking about hepatitis A is transmitted when the fecal matter or poop of a person that's infected with hepatitis A is ingested by a person that is not infected.
even in an amount that is too small to see. This can happen through close person-to-person contact, such as oral sex, or through contaminated food or drinks. Hepatitis A attacks the liver and can remain without symptoms, but if there are symptoms, they may include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, gray-colored stools, joint pain, and jaundice, which is yellowing of the skin and/or eyes. To prevent hepatitis A, make sure to always wash your hands. To reduce your risk during oral sex, use a dental dam each and every time. There is a vaccine available for hepatitis A, and it's mostly recommended for food service workers or those that are at risk for severe complications. Ask your doctor if the vaccine is recommended for you. And now we're going to talk about hepatitis B.
Hepatitis B is a liver disease that's caused by the hepatitis B virus. It can range in severity from an acute mild illness lasting only a few weeks to a chronic serious long-term illness that can lead to liver cancer. Hepatitis B is transmitted when the blood, semen, or vaginal fluid from a person infected with the hepatitis B virus enters the body of someone not infected. This can happen in such ways as sexual contact, sharing needles, syringes, or other drug use equipment. Hepatitis B can also be passed from a mother to her baby at birth. Hepatitis B attacks the liver and can remain without symptoms, but if there are symptoms, they may include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, gray-colored stools, joint pain, and jaundice. Hepatitis B can be prevented through abstinence from oral, anal, and vaginal sex, and consistent use of latex or non-latex condoms. Another important practice for prevention is to not share needles, razors, drug use equipment, tattoo or piercing equipment, or anything that could be contaminated with blood. There is a vaccine available to prevent hepatitis B, and if you were born or started school after 1992, it's likely you have received it. You can ask your doctor if a vaccination is recommended for you. And finally, we're going to talk about hepatitis C.
Hepatitis C is a liver disease caused by the hepatitis C virus, and it is the #1 cause of liver transplants. It ranges in severity from an acute mild illness lasting a few weeks to a chronic, serious, long-term illness that can lead to liver cancer. Hepatitis C is transmitted when the blood from a person infected with hepatitis C enters the body of someone that is not infected. This can happen through sharing needles,
Technology is great when it works.
and ink. It can be spread through sexual contact, but the risk is lower. Hepatitis C can also be spread from mother to child at birth. Prior to 1992, the blood supply was not tested for hepatitis C, so many people were infected through blood transfusions or organ transplants. Hepatitis C attacks the liver and can remain without symptoms, but if there are symptoms, they may include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, gray-colored stools, joint pain, and jaundice.
Hepatitis C transmission can be prevented by not sharing needles, drug use equipment, tattoo or piercing equipment, razors, toothbrushes, or anything that could be contaminated with blood.
It is also recommended to use a latex or non-latex condom during sexual activity. There is not a vaccine to prevent hepatitis C.
We want you to also know that a person could be infected with hepatitis B or hepatitis C for years and not know it if they have not been tested. A person should not share anything that can come in contact with another person's blood, because hepatitis B and C viruses can live in dried blood on surfaces for days to even weeks. An individual with hepatitis B or hepatitis C should do the following things. Stop or reduce alcohol intake because it can harm the liver. Eat a healthy, low-fat, low-salt diet. Drink a lot of water. Get enough rest and moderate exercise. And get vaccinated for hepatitis A and hepatitis B if they haven't already been. They should also see their physician for regular checkups.
And to find out what treatments are available. Okay, so as you can see, I'm not an actress, but it did have a lot of information in there, and we're going to go over it again, because I've heard if you hear something 3 times, you're more likely to remember it. So hepatitis is basically means inflammation of the liver. And so people can have hepatitis that's not related to a virus. So you may have heard of people having cirrhosis of the liver and things like that. That's not related to a virus. That's related to other things, or there's like non-fatty liver disease, those sorts of things. But most often it's related to a virus, and they're designated by a letter at the end of it. So hepatitis A, B, C, there's even a D and G, even though those aren't common in the United States. So as you heard on the video, they're all so different. Besides them all having the same symptoms, all the hepatitis are transmitted differently. So hepatitis A is transmitted through fecal to oral. So you may hear about like restaurant outbreaks that they've had hepatitis A. And in fact, right now in southeast Missouri, we're experiencing a hepatitis A outbreak among homeless population and people who have substance use disorder and are using drugs. The good thing about hepatitis A is that you may be sick for a little while, but it's not going to do any long-term liver damage to you. So you'll be sick, and then your body will clear it on its own, and you won't have any long-lasting effects from it. And once you have it, you can't get it again. As we said in the video, there's a vaccine for hepatitis A, and it's recommended for people that work in the food service industry. In St. Louis and Kansas City, it's actually a law that you get vaccinated for hepatitis A in order to work in a restaurant. So I always say go eat there. Go eat in St. Louis or Kansas City, because we know hepatitis A isn't popular there. Again, once you get it, you can't get it again. If you are interested in the vaccination, talk to your doctor about whether it's recommended for you. Hepatitis B is transmitted through semen, vaginal fluid, and blood. About 15% of people that contract hepatitis B will develop chronic infection, while the other 85% will clear it on their own. Again, there's a vaccination for it, so you can talk to your doctor about whether it's recommended for you. I do want to remind you that hepatitis B is a sexually transmitted disease, using a condom can reduce your risk, or abstaining from sexual activity can reduce your risk for that if you've not been vaccinated. On to hepatitis C, and while we're all here today. So hepatitis C is the most dangerous of the hepatitis, because about 85% of people will develop chronic infections, which means that they will have a lifelong illness related to the hepatitis, and it does the most damage to the liver. The signs and symptoms, like we talked about, were fatigue, gray-colored stools, nausea, jaundice, vomiting. However, most people do not have any symptoms at all. They can feel perfectly fine, and it can take 10 to 20 years before anybody even knows that they have it, and sometimes even longer than that. And by that time, their liver is pretty scarred and pretty damaged. Hepatitis C is spread through blood-to-blood contact only. So any way that you could come in contact with somebody's blood is the way it's transmitted. Hepatitis C can live outside of the body for a very long time, where with most other infections or viruses, they die pretty immediately once they're outside of their host. But hepatitis C is very, very contagious. We have seen documentation where it's been documented to live on a dry or on a hard surface for up to 23 days, even if the blood is dry, and a needle syringe for up to 63 days. So it's a very hardy virus, and that's why it's so contagious. Let me go to my notes here. So does everybody kind of understand what the differences are between all of those? The reason I like to go over those is because a lot of people think that they're all the same, and they'll be like, well, I was vaccinated for hepatitis. Well, remember, you can only be vaccinated for hepatitis A and B and not C. Or they'll be like, I was tested for that, or I had that, and my doctor, I'm cured now. And so it may have been hepatitis A that they had, but not hepatitis C. So it's good to know the difference between all of those. Baby boomers, and why are baby boomers at significant higher risk. They're about 5 times more likely to have hepatitis C. And a lot of people think that it was like the free love Woodstock era of sex, drugs, and rock and roll. And really it doesn't have, it has some to do with that, of injection drug use. But there were a lot of different things going on in the time frame where you guys were growing up. They didn't screen medical equipment for hepatitis C, not because they didn't want to, they just didn't know it existed, so, or that they needed to. Medical equipment was reused oftentimes. They thought that they sanitized it, especially like dental equipment and things like that. But because hepatitis C is such a hardy virus, it wasn't sanitized properly. They didn't screen blood for hepatitis C or organs for hepatitis C. So baby boomers would receive a blood transfusion or a transplant and they contracted hepatitis C that way. And then finally, our veterans that were off in Vietnam and in the military, they were in combat. They may have gotten tattooed in other countries where there wasn't, sanitation requirements the way there are in the United States. And so they may have contracted it that way. So it's really important to know that there are stigmas behind hepatitis C, but most people that have hepatitis C in the baby boomer generation, it had nothing to do with injection drug use. And even our healthcare providers have fallen into this myth that it's mostly baby boomers that injected drugs a long time ago. But that's just not true. And for example, my mom, I told her to go get tested for hepatitis C, being in the job that I'm in. And she went to her provider, and her provider said, well, Nancy, you didn't inject drugs, did you? And she's like, no. And he said, then you don't need the test. So it's really important that you be an advocate for your own health and just say that you want the test. The test is covered by Medicare, Medicaid, and all private insurance companies for a one-time test, and the CDC recommends it. So there is a card, and I'll make sure to get these to the satellite offices as well. And I kind of recommend that you put this in your purse, and the next time you go to your provider, ask them for the hepatitis C test. Again, it's covered by your Medicaid and Medicare and things like that. So there should be no reason why you don't get the test at least one time. And it's a very simple, when they're doing your other blood work, they can just run the test for hepatitis C. And so I also want to clarify that just because you've had your blood drawn, or say you've had your liver enzymes checked, those sorts of things, that doesn't mean that they've screened you for hepatitis C. And your liver enzymes can come back perfectly fine, and you still have hepatitis C.
Why is that they do this?
Well, because sometimes the liver does not, maybe it's not doing major damage at the time. It's causing some cirrhosis. So it's just measuring those levels in the liver, like your bilirubin and stuff like that. And so if those aren't elevated or lower, then they're not going to pick it up on that test.
Oh, that's scary.
Well, and I don't want you guys to be scared.
No. I mean, it's just like beginning with HIV. First they couldn't be detected, and then someone, But for it to be such a serious disease, and I can understand why. So it really doesn't do too much damage to the look of the liver, or?
Well, it can cause cirrhosis in the long term. Yeah, or lead to liver cancer. Yeah, later on down the road.
We couldn't hear what her question was. Could you repeat it?
Oh, I'm sorry. How did we start that? Oh, she said it was scary. And I said, oh, I'm not trying to scare you guys. And she was just talking about how it's scary to think that you could have it and not know it from the test that they're running. Is that enough?
Yeah.
Okay. Yeah, I know, and it is scary to think that you could have no symptoms at all. You'd like to think that you'd feel bad, or that there would be something going on that would make you think that you need to get tested for something. So, let's see here. So I want to talk a little bit about, because I'm sure a lot of you have children or grandchildren, so I want to talk about the other populations that are being affected by hepatitis C. And so, have you heard about, I'm sure you've heard on the news about the opioid epidemic that we're dealing with in this country and the heroin epidemic. So a lot of our young people are getting hepatitis C through sharing drug equipment specifically, or snorting drugs. And while we're seeing the uptick of overdoses and deaths and things in our young people related to this horrible epidemic, we're also seeing a huge uptick in hepatitis C cases. And they're not getting tested because they're actively using. And so we worry about our young people because they're contracting it when they're, at 20 years old. By the time they're 40, they can be very sick if they're not finding out that they have it and getting treated for it. And when you use drugs and you have hepatitis C, it really speeds up that disease process because all of those things hurt your liver. Because even over-the-counter medication and hepatitis C can cause damage faster because everything that goes through your liver, or everything that you eat, drink, medications, your liver has to process those and remove toxins. So it's important if you have family members or young people that you know that are actively using to make sure that they are not sharing drug use equipment, and it's not just the needle, it's any part of their drug kit, and that they're getting tested for hepatitis C. That's just another negative consequence of being a person with substance use disorder. And then, so tattoos are really popular right now, and piercings and things. So if you have grandchildren or children that are getting tattoos, making sure that they're doing that in a safe environment, making sure that they're going to a licensed tattoo parlor to get their tattoos or piercings done is really important. Are there any questions about why baby boomers would be at higher risk?
Could you repeat that, please?
Are there any questions about why baby boomers are at higher risk for hepatitis C?
Did you explain that already? Why?
Yeah.
Okay.
Huh?
No, because of blood transfusion or...
Yeah. Remember, it's just blood-to-blood contact, so that would be, it could have been like when you were younger and you went to a dental appointment, or you had any kind of medical procedure, because they didn't always sanitize the way that they do now. So hepatitis C could have been even in microscopic amounts on medical equipment and those sorts of things.
Question, ma'am.
Yeah.
One or two of us in here may be out of the category of the baby boomers, or are we at high risk also?
So were you born prior to 1945? Yes. I think it would be a good idea for you to still be tested, because it's not just that age group category. It's the time frame that you lived in. So you were living during that 1945 and 65 period of time. So it would probably be a good idea to get tested. And his question was, if you were not born between 1945 and 65, say you were born before that, is it still a good idea to get tested for hepatitis C? And I said, yes, it is probably a good idea to be tested at least one time. Are there any other questions?
Yes, I have a question. I have a question on the vaccine. When you are vaccinated, what is the span? How long is that? Are you covered? Or how long does that vaccination last?
Okay, she had a question about vaccinations and how long they last. Remember, the vaccine is only available for hepatitis A and hepatitis B. But they usually do last a lifetime. We have heard some instances where they have lost their efficiency or effect, but that's not a normal case scenario. Most vaccines for hepatitis B and hepatitis A will last you a long time, or a lifetime, and make you immune for a lifetime.
That's what I want you to say, because in my 30s I got the vaccination. They said it was for AN who working in the hospital as a medical technician. All the staff we had was required of us.
Yeah, and that's pretty common for health service workers as well to get those vaccinations. Did Kansas City have a question for me?
No, we don't.
Oh.
Thank you.
Okay, thanks.
It was Sykeston.
Oh, Sykeston.
Hi, my question is, I've been out there in the field for a while, and I don't know a lot of what you're telling me. And so I'm wondering, are there programs in place to teach this, especially about the tattoos for young kids, while they may be in school? Let them know about this, because I know a lot of kids, and they are out there getting tattoos, and they're doing it in the streets. They're not going to licensed tattoo artists. And so that makes it very, very scary, because they get it multiple times. And so is there some kind of training going on as early as possible with the children, so they'll know some of this stuff? And training us is a good start. That is a good start for families, but you know what I'm saying?
Yes. We do have regional offices all over the state that do go into schools and provide STD and HIV and hepatitis training. So in Sykeston, that would be Butler County Health Department staff go into the schools there. If you have a special request for a school that would like training, you can contact me by my email or my phone, and I can direct you to a person to go into a specific school or area.
Go ahead. All right. Can you hear me?
Yes.
Okay, I want to know, like, my mother and father both died of liver cancer, and they had been separated for years and years. I like to know how both wound up getting that.
Did they have hepatitis C, or did they just have liver cancer? Because you can get liver cancer without having hepatitis C.
So how both of them wind up dying of cancer?
Yeah, I'm not a medical professional, and I'm not familiar with their case, so I can't really answer that question. If they both had hepatitis C, it may have just been the environment that they grew up in. But if it was just liver cancer, there's lots of things that can contribute to liver cancer that aren't related to hepatitis C.
And the toxic what they in your body, you not know it?
Yes.
What was her question?
She had a follow-up question. This is Kansas City still.
Sure.
They can divide be in your body and you will not know it.
What did she? Can you repeat the question?
She said that can it stay in your body and you not know it and develop cancer from that?
Yes.
Liver cancer.
Yes, ma'am.
From that.
Yes, if you have hepatitis C and you're unaware of it, it can lead to liver cancer.
So hereditary. No. I mean, like,
Okay, we have a second follow-up question.
Sure.
Go ahead, Mr.
Hey, I had hepatitis C, and I've been cured of the medication they had me on. But is there any chance of it reoccurring?
I'm so happy that you were cured, and so happy for you. That's wonderful news. His question was, if you have ever had hepatitis C and were treated and cured from it, can you get it again? And the answer is yes, you can get it again. But blood is screened now for hepatitis C. Medical equipment is sanitized appropriately. So unless you are engaging in injection drug use or drug activity, or getting tattoos in an unlicensed tattoo facility, your likelihood that you will recontract hepatitis C is very, very low.
I have a question. I had been into the hospital not long ago, and I had to have blood and everything. I know they check blood and all this stuff, but do they also check you for like hepatitis and all these different things? Because I was in there for about a month or so. So are you being checked for all these different things without, you know, just automatically being checked?
No, you're not. You may have very well been tested for hepatitis C when you're in the hospital, but the only way to know is to specifically ask for hepatitis C testing. When they're doing your normal blood work, they're not automatically testing for that. But because you were in the hospital, they may have tested, but the only way to know is to ask them what you were tested for while you were there.
Okay, and I asked because they didn't know what was going on when I was, let's just say semi-comatose or however you want to go, and then they lost me, brought me back, and they didn't know what was going on. So could they still just automatically just start testing to see what was going on or why, or what was causing the problems? Or
yeah, and I don't know. I don't know if they, I don't know when they, when it flags them to automatically run certain testing in hospitals. So I would ask your primary care physician or contact the hospital and ask them for your lab record of what you were tested for.
They're not going to do those types of testing unless your lab indicates that you automatically need that type of testing. If you come in comatose, what they're going to look for is what caused you to be comatose, such as heart disease or stroke victims or respiratory. They're not going to be looking for hepatitis C or HIV unless your labs come back and indicate that there's a problem with your T cell count or there's a problem with your liver. Then they will look. But if it's not there, they're not going to look. Right.
Thank you, Mercy. Just so you're in on the conversation that we were having here, there was a lady that asked whether or not, when she went to the hospital, if she was automatically tested for hepatitis C. And the answer to that is they're not going to test, and another lady here graciously helped me answer that question. They're not going to test you for hepatitis C unless they suspect that there may be a problem with your liver. So if you go in for like a heart attack or a heart problem, they're not necessarily going to test you for hepatitis C. You have to specifically ask to be tested. And that goes for our young people as well. Even if you go into, or young people go in to get tested for STDs, they're not automatically testing for hepatitis C. You have to ask to be tested for hepatitis C. Good questions. Thank you so much.
I have one question.
Sure.
I have had hepatitis A, and I was jaundiced severely. But with C, there's no jaundicing?
You can. His question was that he had hepatitis A, and he was very jaundiced during that time, and he asked if you can be jaundiced when you have hepatitis C. You can be jaundiced when you have hepatitis C, but more than likely, most of the time people don't have symptoms, but there are people that do have symptoms with hepatitis C, and that's usually if someone has the acute version. It's
very, very sick.
Yeah, and they're very sick, and you kind of know that something's going on. But those are mostly for hepatitis C, acute patients. If you have chronic infection, most of the time you don't have any symptoms.
Thank you.
So since we're talking about testing, is this in your packets? Okay. There is a list in your packet of where you can get tested. You can talk to your medical provider if you have a primary care physician or a regular doctor that you see. You can ask them for the test. But if you don't have a medical home, so to speak, you can go to your local public health department. Does everybody know what a local public health department is? Okay, just in case there are people that don't, each county has a local public health department that you can go and get kind of routine things done like vaccinations or testing, and it's usually at a very discounted price. So if you don't have a regular health provider, you can go to one of the county health departments. There are also federally qualified health centers throughout the state that also provide medical services at a reduced or discounted cost. This is mostly for people that are under or uninsured and don't have a way to get routine medical services. And then there's another website, and this will help you just find a health center in your area. That's Missouri Primary Care Association. And then Hep C Alliance, they're one of our partners, and they provide, they have a provider list of gastroenterologists and people that treat and test for hepatitis C. And then finally, the CDC Get Tested Locator. And this is a great resource for especially our young people. So you can share it with your children and grandchildren. And you can find locations where you can get STD, HIV, and hepatitis testing at a very low or sometimes no cost at all to get tested, especially for those STDs. So those are the resources for that. Let's see. I'm going to talk about treatment, and this is kind of the last thing on our list. There are...
Miss Tara.
Yes.
I had a person waiting to ask a question before you go to the last part. Can this person ask their question, please?
Sure, absolutely.
Okay, I was talking to a young man in California on the phone, and I mentioned to him, he had used drugs in the past, and then he relapsed. So I asked him, I said, have you been tested for hepatitis C? And he said, why? He said, why? And I said, because of using the drugs. And he said, but I don't use needles. I only snort it. And I heard you say that they could get it from snorting it. How can that happen?
Okay, great question. So people that snort drugs, they will often share like rolled up dollar bills or straws, and they're sticking that into their nose. Well, your nose has very small blood vessels in there, and oftentimes people that don't do drugs often have busted capillaries in their nose, but especially people that use drugs do have capillaries that burst in their nose. And so when they snort that, blood particles can get on the straw, and if they share that straw or that rolled up dollar bill and they share it with someone else, then they're snorting that blood right up into their nose that way. So there's one thing that made me think of another thing that I didn't talk about, and that is hepatitis C and sexual activity. It's very, very low risk to be transmitted through sexual activity because remember it's spread through blood-to-blood contact, but it is a risk for men that have sex with men are at higher risk, or actually anyone that engages in anal sex, just because there's more likelihood that blood would be present. So I felt like I needed to at least say that because especially for young people, well, and anybody really, the risk is lower, but it is something that should be mentioned if there would happen to be blood involved during sexual activity. So, now for the good news. There are really good treatments for hepatitis C. Back in the day, there used to be a drug called interferon that was used for treating hepatitis C, and it was very harsh. It was like going through chemotherapy and sometimes even worse. And it was really hard on people, and it's kind of sad if you read stories about people that were on interferon, what they had to go through. And lots of times they wouldn't even be cured after all of that. But now we have new medications, and I'm sure you've seen the commercials on television. And And they're really good drugs with no side effects and very successful cure rates. So that's the good news. The bad news is the treatment is really expensive. Anywhere from $25,000 to $95,000 for treatment. But the other good news is that Medicare and Medicaid have lifted all of their restrictions related to hepatitis C treatment. So there are, if you are on Medicaid or Medicare, you want to be treated, you more than likely can be treated for hepatitis C. So there used to be restrictions that you had to have a fibro score of 3, which means you're very, very sick by that point, and that you were sober for 6 months prior to treatment. But they have lifted those restrictions, and so, like I said, anyone that wants to get treated for hepatitis C that has Medicaid or Medicare more than likely can. And then there are patient assistance programs for people that do not have insurance, and they will often pay for the treatment so that that person can be treated. Any questions about treatment?
I have a question. Yeah, I heard you say something about chemotherapy. Someone that's taken chemotherapy, you said forget that, or?
No, I was just comparing the treatment for hepatitis C to chemotherapy. That would be, her question was, can someone that has chemotherapy get hepatitis C treatment? And I don't know the answer to that. It would be a medical provider to make that decision. I was just comparing interferon to having chemotherapy. Are there any other questions? What time have we got? Oh, well, it's only one.
You can keep going.
I have no more questions.
Hold on just a second. We got a question here in the room, and then I'll get to you.
Okay, the question I have is someone is in the hospital and they are doing, okay, I had 2 patients. One is doing dialysis, and in the hospital when they go into the room where they have other patients, you know, they had to get them from stalls to beds. Now, they have different nursing staff there. After the blood is transformed, that is clean, and goes back into the body, a person that did not have hepatitis B, at the end of the transferring of the blood back into the body, they come up with hepatitis B. And then they have to move that patient over to the isolated area. And now they, what I was told as being a tech is that the equipment was not wiped down, cleaned properly, but the nurses were there doing, you know, all of this. How does this affect the patient? And they have hepatitis B, and I noticed they had it was like 2 weeks they were in isolation before they were able to be brought back out in the community of other patients. How does that affect his family when they come home? Is the family at risk? You know, could you elaborate on that?
Yeah. So she was asking about dialysis patients and hepatitis B and isolation of that patient if they test positive for hepatitis B. And I'm going to speak to hepatitis B and C at the same time when I answer this question. So dialysis is a risk for hepatitis B and C. They do everything they can to prevent people from getting it that way, but it does happen sometimes, unfortunately, because the machines are very difficult to clean. So it has happened, and people that get dialysis or have had dialysis in the past probably or do need to be tested. As in regards to hepatitis B and hepatitis C, there's no need to isolate a person for having hepatitis C or hepatitis B or HIV for that matter. Remember, these are only spread through blood products or hepatitis or having sex with someone that has one of these infections. So unless you're having sex with someone that has these infections or you're transmitting blood back and forth between those people, there's no reason to isolate someone. As far as a household and how to protect your family members and your friends, just not sharing items that come in contact with blood. So that would be razors, nail clippers, keeping those separate from your family members, toothbrushes, those sorts of things. But sharing things like cups or utensils or sharing a meal with someone or any of those things, there is no risk of there's no reason to isolate someone from other people related to that. So when was that, when they would do that? Was it recently that they do that?
That was, that was in 2017.
Wow. I'm really surprised at that.
Wow. When I was there in Colombia. And, because I went to pick up my patient and they were saying, well, it's going to be a while. And that client, he had to stay there for a long time. And he missed his meals, so we had a review. And then we came the next day, they said, well, we're going to have to put him in isolation. Now, when he came back to his room, he had a roommate, he was fine, but just when we transferring his blood and everything, and that's when it was, when they separated. And they had like clear glass, I guess plastic wall or whatever.
Wow. I'm gonna look into
more than just hepatitis B or infestation.
No, it wasn't.
Yeah, I'll have to look into that and find out why that would be. It may be because dialysis and you're exchanging blood, maybe they just wanted him to be isolated from the rest while they were doing his dialysis. I don't know.
They had to go back and flush the machines and everything.
Yeah.
Because they said it wasn't main property. And my concern is, well, maybe the patient before them had, something's wrong. I don't know. But I was just curious because their family was asking me, and I didn't have the answers. I could only go by what the nurses told me,
Yeah.
And can I say something else?
Sure.
Okay, when you was talking about drugs and snort, when you roll up the dollar bill, and when they snort into their nose, sometimes it's depending on the diagonal of the dollar bill. The substance goes up into the nose. But, you have your small blood vessels in the nose. It can burn. And when it burns, that can also cause it to bleed. And when they bring that dollar bill out, there's blood on him. And they're not, I also work in AA and NA also. And we had clients that said, well, they're just trying to get their fix, their high on. And yes, some of them have admitted that, there's been blood, but it was dried up, so you don't use it anyway.
Yeah.
So that's where we had the problem.
Yeah, and that's, she was speaking to individuals with substance use disorder and snorting drugs, and it is a huge problem with our people with substance use disorder because she was commenting about they're just trying to get their fix, and you're absolutely right. We don't have needle exchange or harm reduction services in Missouri because they're not legal. In Kansas City and St. Louis, there are some. But even then, when you think about someone who is struggling with addiction and they're just trying to get their fix, so to speak, the last thing they're going to be thinking about is whether they're using something clean to do it. But we still have to educate those folks about what they can do to help protect themselves. So did we have a question in Kansas City?
Yes, Kansas City has a question. Is it possible that hepatitis C can reoccur even though you've been treated and cured from hepatitis C? Does it reoccur if you don't have the risky lifestyle practices that you had before?
Right. So her question was whether you can recontract hepatitis C if you're not engaging in risky behaviors. And the answer is no. So if you're treated for hepatitis C and you are cured, You cannot be reinfected as long as you are not engaging in injection drug use, sharing items that are contaminated with blood, such as tattoo parlors, things like that. Or not tattoo parlors, but basement tattoos is what we call them. As long as you're not participating in those risky activities, then the chances of getting reinfected are not possible. So, good questions.
Let's try another location. Carellasville.
So we have a second question in Kansas City.
All right, Casey, go right ahead.
Okay.
What are the after effects after while being treated for hepatitis C?
What are the side effects while being treated for hepatitis C?
The side effects for hepatitis C depends on the person and the treatment that you're receiving. However, with most individuals that are getting treated for hepatitis C, the side effects are very low. I've heard that they're headache, maybe some nausea, but for the most part, most people that get treatment have very low side effects. But I think it's mainly based on the individual and the type of medication that they're taking.
Thank you.
Thank you.
I'm sure someplace in the reading material we have, but what percentage of the population get hepatitis C?
So his question was, what percentage of the population get hepatitis C? So our baby boomers, born between 1945 and 1965, are at 5 times greater risk. And then in our young people, it's those that inject drugs or have substance use disorder. So injection drug use or snorting drugs. But those are the main populations. I don't have the percentage data on me right now, but it's estimated that 3.4 million people in the United States have hepatitis C, but it's likely that many others have it as well. They just don't know that they're infected.
Yes, I had experience, and I'm retired in the health field, and I had experience of being stuck by a needle in 1980 and then again in 1990, and they tested me and I was okay, but
oh, good, yes.
Yeah, I was taking care of.
Yeah, yeah. She was talking about working in the healthcare field and having a needle stick. And that is a risk factor for hepatitis C, hepatitis B, HIV. And that's also a risk for our law enforcement officers that are working out in the field and doing pat-downs and searches for drug paraphernalia and those sorts of things. So they usually, as precautionary, they usually will test individuals after a needle stick for those diseases.
Let's keep going. Let's go. Any other questions from this location, from mid-Missouri?
When you said hepatitis C lives outside of the body, okay, and then you said there's no risk to the family members or anything. So how can you live outside the body and won't be no risk?
Well, she had a question about risks to family because hepatitis C can live outside of the body and the risk to family. It would be, the person would have to bleed somewhere in order for it to be, it would be like, this is the way I describe it. Bleeding on a table and it being a risk is very low because you have to be blood-to-blood contact. So she would have to bleed on this table, and then I would have to have an open sore on my arm and touch that exact spot and rub it in for her to transmit something to me. So the risk for family members, you would need to use precautions just like you would. Even if you didn't know someone was bleeding, you would need to wear gloves to clean up that blood and take the proper precautions to clean up blood. Good questions.
I have a question.
Yes, they are. They're so good.
Questions.
I have a question before you leave.
Sure.
Okay. Back in 1977, I worked in the state facility, And then I worked in a facility for the total disabled. So if you can't answer the question, you can, because the other facility was like a mental health facility. So do you think, or I can't remember if you was required to, you know, to take shots to work in those facilities or not. The nurse might know, but I know if you got hurt or something, you had to go to the hospital and be checked out. But I can't remember if you had to take a hepatitis C test or whatever. But I know if you got scratched or something, you had to go be tested for something. I can't remember what.
Yeah. I think that it would probably be dependent if blood was involved at all. So, like if you had a blood splatter that would maybe have been in contact with your eyes or your mouth or something like that, yeah, probably would get tested. Basically, if there would have been blood involved, I think that you would be tested. So.
One more question from Mid Missouri.
Yes.
Well, it's not a question, I have a statement.
All right.
Okay, I just want to say that as of May of 2018, they have shown in the state of Missouri and other areas around that hepatitis C is on a rise, especially prison inmates.
Yes. Thank you so much for bringing that up, because that's one thing that I did not talk about. So 1 in 3 people that are incarcerated have hepatitis C. If they don't come in with it, they get it while they're incarcerated. The main reason is injection drug use in our prisons, which you would think that would be pretty much impossible to do, but they are using drugs in our correctional facilities. And then illegal tattooing. So they're, you know, rigging up tattoo equipment, using pins, anything sharp to tattoo. So anybody that has received a tattoo in prison is in a very high risk for hepatitis C and or HIV, or that has injected drugs as well. So thank you so much for bringing that up, because I didn't. So if any, and they're not testing them, and they test them for HIV if someone's incarcerated, but not hepatitis C. So if you know someone that has been incarcerated, we say longer than 6 months, when they get out, it's important that they get tested for hepatitis C.
Let's move to St. Louis. St. Louis.
Okay, yes, I have a question. I just had surgery, and you were saying how people can get tested for hepatitis C. Before you have surgery, with all the blood work and things that they do, they don't, you know, check to see if your body has, you know, either of these hepatitis?
I can't really speak for like hospital and surgical procedures, because I don't know what their standards are before someone has surgery. But I wouldn't guarantee that you did. I think the only way to know is to ask your provider if you've been tested or received a test, because I don't know what their procedures are before someone has surgery.
Any other questions from St. Louis?
Ms. Gerber, is it possible for us to go ahead and review again, because we had a few people to arrive late, just a quick review of the different types of hep?
Sure. I'll do a quick run through. The question was, can we do a quick run through of the differences of hepatitis? So hepatitis A is spread through fecal to oral contact. So any way that you can get poop in your mouth. The best way, it sounds really difficult, doesn't it? But we've all been in the restroom and watched somebody walk out without washing their hands, haven't we? So that's as easy as it happens. Someone uses the restroom and then doesn't wash their hands and shakes your hand, and then you eat a sandwich before you know, and that's exactly how it happens. spreading through contaminated food, not washing your hands, is how hepatitis A is spread. It is you'll be sick for a little bit, but once you've had the disease, you can't get it again, and it doesn't do any lifelong liver damage. Most people heal pretty well and continue on. There is a vaccination for it, and if you're interested in a vaccine, talking to your medical provider is the best thing to do. Hepatitis B is spread through blood, semen, and vaginal fluid, so it is a sexually transmitted disease. About 15% of people that contract hepatitis B will develop chronic infection. The other 85% will normally clear it on their own and not have any long-lasting liver damage. There's not a cure, so to speak, for hepatitis B, but there are treatments that can reduce liver damage, and it's not as severe as hepatitis C. There's also a vaccine for it. Anybody that was born after 1992, so more than likely your children or grandchildren, have more than likely received that vaccine in order to enter school. So hepatitis C is spread through blood-to-blood contact only. So any way that your blood could come in contact with someone else's blood that was infected with hepatitis C. Our baby boomers are at high risk, 5 times more likely to have it due to health standards not being the same that they are now. Or the other population in our young people is injection drug users or individuals that share snorting or drug use equipment. And there is a cure for hepatitis C, but there is no vaccine for it. So is that good?
Yes, thank you. We have one more question.
Okay.
I have one more question. I know you say when people go into the restrooms and they don't wash their hands, and I'm not one to sit on public toilets. But what about when you go to public toilets and they're not clean, and say someone sit on it, so you cannot contact either of these hepatitis that way?
The only way that you could, I work for the Bureau of HIV, STD, and Hepatitis, and just to be clear, there have been very little things that can be caught by sitting on a toilet seat. Very unlikely to be getting any STDs or HIV or hepatitis from a toilet seat. But with hepatitis A, it is fecal to oral. So if you would happen to sit on that toilet seat and your hand would, or that would somehow get in your mouth, that would be the only way that it could happen. So, does that help? Even though it's gross, I'm sorry.
All right, thank you.
Thank you. Mr. Flowers?
I think I got hepatitis from water in a rural area, seepage through the drainage or whatever, an outside well, and I think it was through the water, so I thought.
Yes, very, very good. He was talking about he contracted his hepatitis A through contaminated water, and that is another way that you can get hepatitis A, as well as traveling to other countries that may not have the same water systems that we do. He was talking about how he was in a rural area and the water, the well, was it a well?
Well.
Yeah, well water. And if you're having a problem with a well, sometimes that may happen. It's rare, but it does happen. Thank you for bringing that up.
No, it was called a cistern, not a well.
Oh, it was a cistern.
Contained area for water.
Yeah.
I've heard that before, what Mr. Flowers had just said, that someone in a rural area, actually in southeast Missouri, contracted that through the water system.
Yeah.
Thank you for bringing that up.
Yeah, good.
Okay. All right, so we're about to wrap it up, but we want to hear from southeast Missouri.
I got a question. In 2000, my husband had hepatitis C, and I was tested. I didn't have. Do you think I need to be tested again?
Her question was, if her husband had hepatitis C and she was tested previously and it was negative, does she need to be tested again? And the answer is no. Unless you've had any other risk behaviors, a one-time test is all that's recommended for baby boomers. And so no further testing would be needed.
All right, thank you.
Can I ask a question on that?
Mm-hmm.
She said her husband had it in 2000. Why wouldn't she be retested? If her husband just had it in, even though she's a baby boomer, and her husband was tested in 2000.
Did she say her husband was cured?
No, she didn't.
Did you say, was your husband cured?
He's not cured. He's on dialysis now.
Okay. If he still has hepatitis C, I would recommend I would talk to your physician about what would be recommended and how often to be tested. We typically recommend that you get tested for hepatitis C every 6 months if you have a risk behavior. But I would talk to your physician about how often they would recommend testing for you.
All right. Okay.
Thank you.
Thank you.
Thank you for clarifying that.
Absolutely. Any other questions from Carruthersville?
We was Carruthersville.
But any other questions?
No, I'm sorry. There's no more questions.
All righty. Let's move up to Sykeston.
All right. Thank you.
Thank you.
Please clarify active and inactive hepatitis C.
Which side is this?
Active and inactive.
Right. Yeah. Active and inactive.
Clarify. Active and inactive.
Active and inactive
Okay.
C.
Okay, we designate them as acute versus chronic. Acute means that it's a short-term illness and that you no longer have active infection. And chronic is meaning that it's active and that your body has not cleared it on its own. So it means that the virus is still active in your body and is could be doing damage to your liver.
Thank you. Yes.
I have a question. In 1944, my sister was diagnosed with what is Hep C?
Hep C.
No, that
Sickle cell. Sickle cell.
no.
Cirrhosis.
So what she was talking about?
Hepatitis C.
Hepatitis. Diagnosed with hepatitis. They didn't add the word C or whatever to it because I don't know. We lived in a rural Mississippi, and they quarantined our house, so none of us could go anywhere. The doctor would come to the house, and he said that she had hepatitis, and it would eventually break her back, but it did not. But she died at the age of 4, and later on, after I got grown and my grandson had sickle cell. So when she was sick, she acted more like she had sickle cell than hepatitis. Now that I'm grown and can see the difference, could she have been mixed diagnosed?
Yeah, and
It's those two diseases mimic each other. Hepatitis C and sickle cell.
And we're talking about like 44 country doctors.
yeah, in 1944, I don't think hepatitis C was not yet known at that time because we had hepatitis A, hepatitis B, and then they had non-hepatitis A and B for a long time before they even called it hepatitis C. And I wish I knew the year that it came out. Hepatitis C was first diagnosed, but I know that it was not in 1944. But And I'm not familiar enough with sickle cell to know if they are similar or not. I don't think that they are, because I think sickle cell is a blood disease, if I'm not.
It was 1989.
Yeah.
More recent.
She was just get a excruciating pain.
Yeah.
Almost all the time.
Oh, I'm so sorry to hear that.
All right. Are there any more questions?
Yes, I have a question. When you were talking about the liver damage, does the liver stay damaged, or does it heal itself after you take the treatment?
With hepatitis C treatment, they have found that people go on to live very healthy lives. Your liver is a very forgiving organ and can regenerate and heal. So most people that have hepatitis C treatment will carry on with their lives and not have any other further complications related to the hepatitis C virus.
All righty.
Thank you.
Thank you. Charleston, do you have any questions?
No questions.
All righty. I think we're about to wrap it up. Going once, going twice for Mid-Missouri. Let's give Miss Tara McKinney a big round of applause.
Thank you guys so much for today, and all of your questions have been wonderful, and your attentiveness. I really appreciate the opportunity to be here today, and you all have been a great audience. If you ever need anything, please reach out to Ms. Deborah, and if you want to ask me questions, feel free to email me or call me, and I'll be happy to help you with anything you need.
Do you have a business card?
I didn't bring any business cards with me today because I'm out right now. But, and if you ever need anything related to the STD or HIV, that's my bureau. We do lots of presentations all over the state. We'll go to churches, we'll go to schools, in prisons, we go to rehab facilities, we go to just about anywhere out there in Missouri, and we have people all over the state that can meet you where you are and do those types of presentations, so we welcome that. Thank you and have a great day.